Misconceptions of mental health first aid. So I had my selection day at the Samaritans on Saturday, and you'd assume within that service that all the Samaritans would have the mental health first aid qualification. So I asked, I said, like, who out of this group of Samaritans, because you meet current Samaritans, people who've been working for them for a while, trainers, who's qualified in MHFA? And they said, oh, just a couple of people out of the group. So I asked why. I thought, why would the Samaritans not, as standard, put their people on the phone through mental health first aid? And he said, well, only 25% roughly of our callers have mental illness. And I thought, that's the misconception, that's the misunderstanding about mental health first aid. Mental health first aid can support people going through a level of stress, a level of anxiety. Yes, it will cover and support people with mental illness, but if you've got thoughts, feelings, emotions, behaviours, habits, basically if you're human, then mental health first aid can offer a level of support. You don't need to be suffering with severe mental illness or poor mental health for mental health first aid to be relevant. If you want to support yourself, live better, support people around you, offer suggestions of well-being practices, offer and share ideas of things you can do to stay happy, healthy, well, the mental health first aid is relevant. It's not limited to those who want to support people going through severe mental illness. In fact, I'm that confident that mental health first aid is relevant for pretty much anyone. If you do our course and you don't feel it's added value, if you do our course and you don't think it's improved your life, if you do our course and you haven't enjoyed it, I personally would give you money back. And that's not a hard sell. That's because I'm passionate about this. Because if I'd have met or had access to a mental health first aider when I was going through my struggle, my journey, then absolutely my journey would have been much, much easier. Had I had access to someone with a level of skill and knowledge, and I said, you know what, this is how I'm feeling, this is what I'm thinking, then absolutely my journey would have been so much more straightforward. Instead, what I was met with is what you'd expect. Cheer up, calm down, man up, get over it. People who meant well, but they just offered these suggestions that really didn't help or add any value. So that's why I'm passionate about this course. It's relevant for pretty much everyone, in my opinion.